Hi everyone, I'm GREYMOND. This is OCD Recovery Q&A. If you have left me a question under any of my previous videos, we're going to answer it on today's show. And if you would like to leave me a question, then you can leave it below this video and I'll pick it up on the next show. So the first question is, why do I sometimes have OCD-free periods where OCD doesn't bother me? So what happens is, as you go through the process of recovery, you're kind of going through the process of unplugging. So either your OCD hasn't developed into the type of OCD where it's with you 24 hours a day, so that's why you're having breaks. Or the other possibility is you're just doing the work and you're in the stage where, now you're seeing some breaks. Either way, it's not that strong where it's lasting 24 hours a day. So that's fine. But you have to now do the work to push it further. The process of unplugging, the process of recovery from OCD, is that the person will start out having most of the day in OCD thoughts. Then they'll have periods where, I didn't even have OCD for an hour, or for even, like, it starts out as like 5-10 minutes, right? They didn't even have OCD for this time, and then it goes further where for a week you didn't have OCD, for a month you didn't have OCD, until it fully goes away. So that's just the process of unplugging. That's what you should be seeing. So that's really where you are with it. You just have to keep going further. But this is a good sign. It just means your brain is not so attached to fear that it thinks you're in danger 24/7. So, like I said, again, it's either because it didn't develop or because you are doing the work, and you need to do the work to recover. So next question is it okay to check only once? And I would say no, and the reason being that if you are in a position where you're okay with not checking any other time except for once, then you can push through and not check at all. If you would like to have, kind of a little bit something to grab onto, to try to delay. So, okay, I will check once, but not right now. Say 5 hours from now I will check, or something like that, where you have to go further in the recovery. If you start getting into this, well, I'm only going to check everything once, and you get stuck in doing that pattern, then that's not good either. So you have to make sure that you are putting in the work and going further from that. If you can't refuse to check at all, at least delay. So next question is about harm OCD. The person says that they're feeling lack of empathy and almost like they want something to happen to someone. And again, this is very common. OCD attaches by feelings. So feeling detached, feeling like you don't even care, feeling like maybe I want this, or feeling like you do want this. This is all part of harm OCD, and it's very, very common. The difference is that you are not okay with feeling like this, and I mean, you're writing it on, OCD recovery show. So obviously this is OCD. You have to stop paying attention to these thoughts. Yes, you feel like this. It doesn't matter. Who cares? Push through. That should be really your attitude. That if it has to do with feelings, OCD making you feel a certain way, it really doesn't matter. In terms of harm OCD, this is pretty much classic harm OCD. So there's nothing abnormal in feeling lack of empathy or feeling like you want something bad to happen. I mean, this is just kind of like how harm OCD gets people. Because you have to remember that if OCD didn't feel real, like you didn't really feel like you don't care and all of this, you would be able to see through it. You wouldn't develop this, OCD problem, OCD situation, right? Because you would be like, wow, this is a silly thought, I don't care. But because it feels so real and so true, that's how people get stuck in it. So that's just part of the course. You have to step over it, step over the anxiety and refuse. And that anxiety is not going to go away the second you refuse, but you have to, for a certain amount of time, live parallel to it. Like, yeah, it's telling you all this, but just like we were talking in all my other videos, you're walking down the center of the corridor, things are happening here, screaming at you, whatever. It doesn't matter. It's just, you just keep going. Next question is, The person is having OCD thoughts about not doing enough for the environment, worrying that maybe like they're not doing recycling correctly, like different like bugs and animals and all of this kind of stuff being killed, and experiments and all of those types of things. And again, it's more or less a normal thing to think about. And we all kind of, obviously we all care about the environment, or we all try to do our best. But when it's becoming on a level of compulsion, when you're feeling anxious about it, that's OCD. So it shouldn't be giving you anxiety how it is. And if you feel like, well, if I don't do it, then I'm a bad person, it almost becomes like a variation of harm OCD. That I feel like instead of like, with regular, the classic, I guess, harm OCD, person will think that I'm harming someone else. Here, you feel like you're harming the environment by not doing enough. So you have to pull back and say, you pick a person who is, in your immediate circle, who you know well, what would they do? And then kind of mimic their behavior. So because that's kind of the best way to approach the types of OCD where somebody else could have the same worry, but where's that line where it becomes OCD, right? So not doing more than a person who you look up to would. Next question is, will choosing not to pay attention to thoughts and taking medication be enough to overcome OCD? Choosing not to pay attention to the thoughts over and over again, not giving a reaction of fear, coming from a position of power, that alone will be enough for you to overcome OCD. Now, it's not going to take like one time I refused, why am I not recovered? You have not refused about 1 billion times, right? Now I'm just kind of saying that's for all of us, right? It's going to take repetition. You have to be prepared for that in the beginning, anxiety gets worse before it gets better, because the mind is used to you reacting with fear. The second you stop reacting with fear, it's not going to start to go away. So just kind of prepare yourself that in the beginning, it's going to be the hardest. If you do this, you push through, you keep going, you will recover. In my experience, and again, a lot of the times people will think that just by listening to one of my shows or something like that, that I have a negative view on medication. It's not so much that I have a negative view on it. It's that, and again, I'm telling you, I say 8 years of experience, but now it's more than 8 years. And I don't see it working, So I would love to be able to tell you that, just take this magic pill and all of it will just go away. I don't see it in practice. People say it takes the edge off, and that's kind of the best of what I hear. Even then, I don't hear it that often. And usually when people say it kind of helps, it's kind of like they say it with like a question mark on the end, where they're not even sure if it kind of helps or not. So I don't find it to have a dramatic effect on recovery, put it that way. It might have some little tiny bit of an effect, but 90% is going to be not paying attention, pushing through, coming from a position of power. And the other 10% could be medication, meditation, living life as normal, diet, all those kinds of things, right? But 90% of it is the actual, what we talk about on the show, doing the work, the not giving attention, the coming from a position of power. So yeah, you do this, you'll recover 100%. Next question is, OCD about touching things to get the right feeling or sight as the initial first time. It's really hard to let go of reassuring. Okay, so you have to start somewhere. So what is the least distressing thing for you to do in terms of like physical exposures, right? And then working your way up from there. But every day or every few days, you need to be making a step forward. So if you're doing this on your own, make a list of things that you're doing and start to actually physically knock them out. That, okay, I was scared of this, and this. I've gotten rid of this. Okay, and this will give you momentum and help you keep going. But you have to be motivated to actually do those things. With physical compulsions and physical rituals of doing things, it's doing it a lot of times how you were supposed to do it without doing the compulsion, right? So say, for example, if you I don't know, wash a certain way. You have to step over the anxiety and wash how everybody else would wash. Or whatever action it is, do how everybody else is doing it. Over and over and over again. And after you do it 100 times, I guarantee you your anxiety is not going to be as high as when you did it the first time. Or when you were refusing and it felt so scary to even approach this situation. So it's just really, okay, you know what, I need to focus, I need to do the work, and as you do the work, you will see that it's working. You won't need me to tell you that it's working. You'll see it on your own. That will give you momentum. You will feel more power, and it will be easier to keep going. But you do have to start somewhere. So even if you start the smallest little step, it's fine, but you have to actually start. So thinking about it is not enough. Wanting to recover is not enough. You actually have to work on the recovery. Hi, Ali. Do those with OCD have different brain chemistry? Do we start naturally to become negative or prone to OCD and anxiety and depression? And again, coming from experience of talking with different people from different countries, different situations, I can tell you, if people, how say some doctors are like, oh, let's talk about your childhood. I've talked to people who had the worst childhood possible, the best childhood possible. Okay? Doesn't make a difference. Both of them are getting OCD, right? So those things don't really matter, but I do see that pretty much every person I've ever talked to who had OCD are very, very sensitive. So I think that from the beginning, the person is born with, to put it in plain terms, a sensitive brain, a sensitive, a more gentle brain chemistry, so to speak, more prone to anxiety. But you take that person, and anytime that person goes into stress, if they're already anxious, if they're already prone to getting OCD, any kind of stress, good or bad, I've seen people who haven't had negative stress, they had positive stress, such as, buying a house, getting married, having a baby, getting a good job, and that stress causes OCD. So it's not something necessarily negative. It's just something that's high stress, high energy, that more than the person feels like they can handle. So in that way, I do say that generally people are prone some people are prone to getting OCDs, the people who are born sensitive. But as you work on it, you strengthen your mind, and I do see a difference, even with my own recovery, from the person that I was before the recovery, right, to the person I was immediately after the recovery, to the person that I am now, right? So you start out being very sensitive, then you get OCD and just everything goes awry. Then you recover from OCD, you go back to being sensitive, right? And then you work so you start to work on that sensitivity kind of the same way you worked on OCD. So say you have real life situations, real life worries, fears, good or bad situations happening to you. You apply the same technique that I'm getting too much into it, this is too much, I'm not paying attention, I've gone too far, right? And then you start to reduce that overall general sensitivity, and it's easier to live that way. But at first you need to tackle the OCD recovery, and then you can tackle that as well. And then, as you become less less prone to extreme reactions to stress, then, and as you've done all this work to recover from OCD, the chance of you developing OCD again is pretty much nothing, and you just live life better, I mean, there is a silver lining to it, because after doing all this work, after going through OCD recovery, which is, it's not a long process, but it's still a process. You do gain this control that most people never actually even have over their thoughts, where they understand, okay, I got a thought, I can do whatever I want with it. I can pay attention to it, make it more important in my mind, not pay attention to it, make it better in my mind, so you start to get this control, and you're able to process things better, faster, more efficiently. Okay, next question is, having OCD and having physical problem. The person says halitosis as well as OCD. So I would say you have to work on both, but don't use halitosis to kind of do OCD avoidance as well. In terms of halitosis itself, again, I'm not an expert, but I would suggest trying a plant-based diet. It would seem like it would be something that works, but again, I'm not an expert on that. But in terms of OCD, don't allow it to be kind of like an excuse, like, well, I don't want to stand too close to people, so I'm going to be further because it's also an OCD thing, So OCD is a separate issue, and you have to do exposures as well for it. So even if it makes you uncomfortable, do at least some exposures where you are standing closer to people. Next question is, I still can't seem to refuse anything and to sit with anxiety. I give in every time to make sure that it's just OCD to relieve the guilt, worry, or fear. How can I recover? If you keep doing this, you won't recover. And I'm being 100% serious. You actually have to do the work. When you're giving in, every time you're giving in, you're not doing the work. So it's not only that you're not recovering, you're actually showing your mind that you're scared, that this situation is important, and in that way, you're making OCD worse. So you're actually, it's not that you're just kind of like, oh, well, I just relieved the anxiety, I had to give in. No, you right now made OCD worse. So how many times are you going to make OCD worse until you actually start doing the work? Think, and to motivate yourself, think of it, how much you've lost in your life because of OCD. Are you going to continue down this road, or are you going to pick yourself up and actually start doing the work now? Because that's kind of what it was with me as well. You have to understand, that these things, no matter what kind of OCD you have, right, it's still all make-believe. But the moments that you lose because of OCD are real, and, don't allow yourself to lose any more. What you lost in the past is already lost, but don't continue to do this to yourself. Pick yourself up now, say, you know what, I'm done with this. Get tough, start doing the work. Then you will recover. And it actually doesn't take that long to recover. And again, if it's physical compulsions, just little by little by little. If it's mental compulsions, mental analyzing, setting yourself a limit. So, okay, I'm going to refuse. If you can't fully refuse, then at least delay, but really work on, and you can come at it from kind of hyper-focused, kind of organized situation if you like that, and really actually keep track of how much time in a day you're spending analyzing. And it doesn't really matter where you start, as long as you start to cut it down. So even if you're spending, say, don't just say like, okay, I spent 24 hours. Well, no, it's not 24 hours. How many hours exactly? And then how many hours is it going to be tomorrow? And let's start actually cutting it down. So, and, in terms of going through your day with this, because the person says 40 years of it is too ingrained. It's not too ingrained. People recover after 40 years, it doesn't really matter. It matters what you do now. How can I go through my day with that much anxiety? I forget the obsession eventually. Will I forget the obsession eventually if I ignore it? Yes. You will forget the obsession if you ignore it, because it doesn't really matter. How can you go through your day with this much anxiety? You just have to be parallel to it. Try to stay busy. Try to see the goal of recovery. There is going to be that much anxiety, and you have to go through your day with it. There's not much of a way to get around it. your mind has to feel the anxiety and see that nothing bad is happening for it to start to shift how it's viewing the thoughts. You know, there's not really a workaround. You know, that's just what's going to have to happen for you to recover. And, you know, to be honest, you don't really have another option, because the other option would just be to continue to have anxiety and continue to have OCD. So in one scenario, you have anxiety, but you are recovering. In another scenario, you have anxiety, but you're going from thought to thought with still same anxiety, and you're not recovering. So which one are we going to choose? Either way, it's anxiety. So let's choose the recovery. Next question is, I made myself have a bad thought and I almost threw up. No anxiety, just felt sick. That's fine. It's pretty... you know, I mean, it happens, you know. I would say when your level of OCD, if you take people who have level 10 out of 10 OCD, it's actually fairly common to have physical symptoms attached to it. As OCD goes down, you won't experience this. You just have to power through. You know, think of all the stuff that you've lost. Don't let yourself lose anymore, and just power through. You know, it's not going to be like this forever. I promise you, it won't be like this forever. I am unable to go to work here. I have OCD, but people are continuously, without knowing what I'm going through, without my permission, give me suggestions like, you should go to work, you should do this and that. My question is how not to get disturbed by people's advices and opinions. So, you know, everybody has an opinion, you know, and you can choose to listen to it and pay attention, or choose not to listen to it and pay attention. In terms of saying, I can't do this and I can't do that, just be careful with that. I understand that sometimes you do feel like you just can't do it, but at least try to work part-time, you know, even if it's just 1 day a week, because you need to show your mind that nothing is really wrong. The more you show your mind that this is bad, everything is wrong, I can't do anything, the worse it's going to be. You know, if you show your mind that you are the boss, you are in control, you're going to start to feel better, just because that alone makes you come from a position of power. So it's just important to do. At least it's like, just push yourself forward as much as you possibly can. But if at the same time, if the person is telling you, well, why aren't you working all the time, full time, and doing all this, and you should be, you know, that's kind of, they're saying it from a position where they don't understand what you're going through. You know, so you have to decide what's right for you, never mind what somebody who doesn't understand is telling you. But at the same time, also don't do avoidance, and don't make it just because, well, it's uncomfortable for me, so I'm not going to do the work, because that way you won't recover. You know, so it's a fine balance, and you have to be your own kind of motivator to push yourself to recovery. So that's what it is. Every day, every moment of every day, pushing yourself forward and forward until you fully recover. So we've come to the end of the show. If you would like for me to answer a question, please leave it below this video. If you would like to sign up for the recovery program, all of the information is available on youhaveocd.com. Thank you so much for watching. I'll see you in the next video.